बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलामु अलैकुम रहमतुल्लाहि व बरकातुहू। बोन कंपोजिशन को देखते हैं। ऑस्टियोसाइट्स bone cells are in a mineralized matrix. The matrix has a framework of the protein collagen surrounded by calcium and the phosphate crystals. Calcium carbonate and the calcium phosphate makes up 60 to 70% of the bone weight, provides much of the bone's stiffness and resistance to force. Collagen, a protein, gives bone its flexibility and contribute to its ability to resist forces. With aging, collagen is lost and bone becomes more brittle. Water. Bone consists of small proportion of the water. Function of the skeleton. Support. Skeleton provides a rigid frame for the support of the soft tissues and organs. Protection. The skeleton protects vital organs. Locomotion. Bone provides attachment sites for the muscles, allowing for the movement of the limbs. Blood cell production. Long and flat bones provide a site for the production of the red and white cells and platelets. Mineral reservoirs. 99% of the body's calcium and 85% of the phosphorus is stored in the bones and teeth. Mineral trap. Bones provide a trap for the dangerous minerals like lead. Effects of the activity on the bone. Bones respond dramatically to the stress or lack of stress. That is, the lack of stress will decrease the bone density, and increase stress will increase the bone density, and stress remodels and changes the shape of the bone. Bone classification according to the degree of porosity. There are two portions of the bones. Outer one is called the cortical portion, and the inner one is called spongy or cancellous portion. The outer one shows low porosity, that it is a compact, dense, solid portion. This one is a compact, dense and solid portion. Forms the outer shell of the bone. This is the outermost portion of the bone. So this is called cortical bone. And then the central portion. This is a cancellous bone which has high porosity. So this is called a spongy bone. This is a lattice-like portion in central region of the bone. Shapes of the bones. Short bones includes bones of the ankle and wrist. Here we see this is foot and this is the wrist. Serves as a good shock absorbers. Long bones like femur of the thigh and humerus of the arm and forearms. Any bone whose length greatly exceeds its diameter are less, and length is more than the diameter. It provides levers for the movement. Flat bones include the bones of the skull, scapula, ribs, sternum and clavicle. Here we can see skull bones or flat bones, scapula and the ribs and the sternum and clavicle, they are all flat bones. Irregular bones includes bones of the face and the vertebrae. This is bones. This is the picture of the bone of the face. That is the facial bones. And here we see images of the vertebrae. And these are irregular bones. And then small bones, which are called sesamoid bones, which includes patella. This is a kneecap named patella. Oval like a pea and found in the tendons. This bone is basically located within the tendons and often function as a pulley. There are a few terms we should know. Os means bone. Osteoarthritis and osteoporosis means inflammation of the bones, especially involving joints. Osteoporosis means there is reduction in the bone density and bone become weak. Processes. This is a spinous process. These are basically bony projection. This is a transfer process, bony projections. Coracoid process. So these are our finger-like projections from the bone. Here we see this is a shelf-like projection which is called spine, and this is a shallow area above and below the spine which is called fossa. Here we see enlargement for the articular surfaces. Articular ends becomes a bit prominent, so they are called condyles, and there are small projection or bumps for the attachment of the tendons or the muscles. These are called tubercles or tuberosities. Epi mean above or upon, epicondyle or epiphysis. Peri mean around, periosteum and pericardium. Arthro mean joint, articulation. Arthritis and arthroscopy. Here we are responsible for everything except bones of the skull, bones of the wrist, carpals. We learn only scaphoid and leonate bone. Bones of the ankle, that is the tarsal bones. We learn only the talus and the calcaneus in this presentation. Thank you very much. Assalamu alaikum warahmatullahi wabarakatuh.